I'm Nurse Ashley, and today we're going to talk about infection control and isolation precautions, a topic that's essential for safe nursing practice and really a frequent focus of NCLEX questions. Remember, this content is for educational purposes only and isn't a substitute for professional medical advice. By the end of this video, you'll feel more confident understanding the different types of isolation precautions, the appropriate use of PPE, and strategies to prevent the spread of infection in healthcare settings. We'll also work through practice questions to help you apply these concepts to real-world scenarios. So let's dive in. Infection control is a cornerstone of nursing practice because it directly impacts patient safety. The NCLEX often tests your ability to prevent hospital-acquired infections, or HAIs, by following proper protocols. These questions frequently involve hand hygiene, PPE selection, and knowing which type of isolation precaution applies to specific infections. For example, you might see a scenario with C. diff, where a patient receiving care for this condition, the test will ask you which hand hygiene method you should use. It's soap and water, not hand sanitizer. This is a classic question. Now, let's just start with the basics. So, standard precautions. This is really the bare minimum infection control practice that applies to all patients, regardless of their diagnosis. Think of standard precautions as really your default mode. This includes performing hand hygiene before and after patient contact, wearing gloves when touching bodily fluids, and properly disposing of sharps and contaminated materials. The NCLEX might ask about best practices for preventing needle stick injuries, such as never recapping the needles and disposing of them immediately in a puncture-proof container. Hand hygiene is the single most important measure to prevent infection, and the NCLEX loves to test this question. You'll need to know when to use soap and water versus alcohol-based sanitizer, as I already mentioned. For most situations, hand sanitizer is effective and convenient. However, for infections like C. diff, which produces spores, so gross, soap and water is mandatory because sanitizer won't remove the spores. So if you see a question about a nurse exiting a room after caring for a patient with C. diff, the correct answer is always wash hands with soap and water. Trust me, once you've done that in real life, you're going to want to completely shower, not just wash your hands. That's kind of like a fun way to remember it. Now let's move on to isolation precautions. So the NCLEX categorizes these into three main types: contact, droplet, and airborne. Knowing when and how to apply these precautions is critical on the test and in practice. So number one, contact precautions are used for infections spread through direct or indirect contact, such as MRSA, VRE, or C. diff. Patients requiring contact precautions should be placed in a private room if possible, and healthcare workers must wear gloves and a gown when they enter the room. The NCLEX might describe a patient with uncontrolled diarrhea and ask what type of precautions are needed. The correct answer is contact precautions, and you should also ensure proper hand hygiene with soap and water. Droplet precautions are for infections spread through large respiratory droplets. Think influenza, pertussis, and certain types of meningitis. A surgical mask is required within 3 feet of the patient. The NCLEX could present a scenario where a patient with suspected influenza is admitted and ask you what protective measures you should use. The answer should include a mask and standard precautions, emphasizing the need to prevent droplet transmission. Airborne precautions are for infections that spread through tiny particles that remain suspended in the air, such as tuberculosis, measles, or varicella. Patients should be placed in a negative pressure room, and healthcare workers must wear an N95 respirator mask. The NCLEX might describe a patient with a persistent cough, night sweats as hallmark, weight loss as well, which would suggest TB or tuberculosis. And they'll ask, what should the precautions be? Airborne precautions would be the correct answer, and initiating them as soon as TB is suspected is key to protecting others. In addition to isolation precautions, the NCLEX often tests your understanding of PPE or personal protective equipment. The sequence for donning and doffing PPE is crucial to preventing self-contamination. When donning PPE, the order is gown first, followed by mask or respirator, followed by goggles or face shield, and gloves last. When doffing, remove gloves first, followed by goggles or face shield, gown, and then mask or respirator. Hand hygiene should be performed immediately after removing all PPE. A common test question might describe a nurse doffing PPE incorrectly, and your job would be to identify the mistake or the risk it poses. Another area of focus is caring for patients with multi-drug resistant organisms, also called MDROs. These are conditions like MRSA or VRE. These patients require strict adherence to contact precautions to prevent the spread of these resistant infections. The NCLEX may ask you how to handle shared equipment, such as blood pressure cuffs or stethoscopes specifically. The correct response is to use dedicated equipment for that patient whenever possible, or thoroughly disinfect shared equipment after each use. Now let's work through a few practice questions. Here's the first one. A patient is admitted with suspected tuberculosis. Which is the best room assignment for this patient? A private room with droplet precautions, a negative pressure room with airborne precautions, a semi-private room if the other patient also has TB, D, a private room with standard precautions only. I'll give you a moment to think about it. The correct answer is B. TB requires a negative pressure room, as we already discussed, and airborne precautions to prevent the spread of infectious particles. Placing the patient in a regular private room or relying solely on droplet precautions would not be sufficient to prevent the spread of disease. You observe a nurse exiting a room with a known C. diff patient, then using an alcohol-based hand sanitizer. What's the best immediate response? No action. This is acceptable practice. Remind them that soap and water is required for C. diff. Alert the charge nurse to file an incident report, or ask them to double up on sanitizer just to be safe. The correct answer is B. C. diff spores, as I mentioned, aren't removed by hand sanitizer, so soap and water is the correct method. Politely reminding the nurse ensures patient safety and reinforces proper infection control practices. And one more, a patient with influenza needs to be transported to radiology. What's the best action to minimize infection risk? A, have the patient wear a surgical mask during transport. B, apply a gown and gloves to the patient. C, cancel the transport until the symptoms improve. Or D, transport without precaution since the risk is low. The correct answer is A. Influenza spreads through respiratory droplets, so having the patient wear a surgical mask helps prevent transmission during transport. Gowns and gloves aren't necessary unless there's a risk of contact with bodily fluids, and delaying necessary procedures isn't appropriate unless absolutely required. As you study for the NCLEX, remember that infection control is all about breaking the chain of infection. Proper hand hygiene, correct PPE use, and understanding isolation precautions are your first lines of defense. Always prioritize patient and staff safety by adhering to guidelines, and don't hesitate to escalate concerns if you notice lapses in infection control practices. If this video helped you understand infection control and isolation precautions more clearly, please give it a thumbs up and subscribe for more nursing tips tailored for the NCLEX. I'm Nurse Ashley, and I'll see you in the next video where we'll break down another critical concept to helping you succeed on your exam and in your nursing career.